Hey everyone, Kelly Mahler, occupational therapist, and I want to take the time to talk about alexithymia and interoception. Yes, this is a topic that we've talked about before. It is a very common question we hear. Lots of people curious about alexithymia and interoception, so I wanted to take time to talk about three things that aren't typically part of the conversation with alexithymia. But first, let's talk about, in case this term is new to you, what is alexithymia? It is defined as difficulty identifying and describing the way that you feel. Recent research has really shed light on the underlying mechanism that might be contributing to alexithymia is interoception. Interoception is that sense within all of our bodies that lets us know how our body is feeling. We might experience a wide variety of sensations, and it's different for each person. Maybe you notice like your heart racing or muscles are tight or a zappy feeling through your body, and we feel these sensations because of interoception. So those sensations are really important to helping us identify and describe the way that we feel. Let's dive into three things that are typically not a part of this discussion when we are talking about alexithymia and interoception. So number one, as I mentioned, alexithymia, part of it is difficulty identifying how you feel. And while this can be a very true experience for an alexithymic person, there also are some people out there that might be labeled as alexithymic. However, they do really understand how they feel. It just is that it's not a match for the one-size-fits-all emotion approach that is commonly used. Many times we tend, or our society tends to talk about the way emotions should feel. And what we're learning from interoception science is that there is no single footprint of emotion, and that the way that, say, for example, anxiety feels like in your body is different than what anxiety feels like in my body. What hunger feels like in your body, different than what hunger feels like in my body. So when we teach, for example, like that hunger is growling stomach. If that growling stomach doesn't happen for you, that is not your body sensation letting you know when you're hungry. I have so many clients that are just waiting for that growling stomach. And if it doesn't happen, then they think they can't identify hunger. When actually, when we do a lot of interoception exploration, what we find is that they do have a body signal letting them know when they're hungry. It's just different than what we might traditionally talk about. So for example, I have a client that gets zappy feelings all over her skin, and we have come to discover that that is a sign for her that she is feeling hungry. Well, no one walked around teaching her that a long time ago when she was young, that zappy feeling skin means hunger. And so we just have to really take a step back and think about the way we talk about emotions and the way that emotions feel, and embrace this notion that emotions are different for each one of us, and they can feel differently for each one of us. And that's the beauty of interoception work. It really helps us to explore our body signals, find patterns in those body signals, and then give meaning to those patterns of body signals. Okay, number two is really getting at the second part of alexithymia, and that's describing the way that you feel. And there's lots of alexithymic people that truly do have difficulty putting words to their experience, to their internal experience. But there's also a lot of people, a lot of my clients that share that they do know how they feel and they could describe it to somebody else, but over time they've been given this accidental message that you must translate your inner experience through emotion words. And many times those emotion words can fall short for a variety of reasons. Maybe one word is not enough to describe the extensive inner experience that one person can have. Maybe those emotion words are not meaningful to a person's neurology. Maybe they would do better describing their inner world through songs or through drawing or through other types of art or through noises or GIFs or video clips, or maybe even it's through talking about the way they're thinking about their inner experience rather than feeling. So we really need to expand our definition or understanding of how someone might come to describe their inner experience. That that those emotion words, those traditional emotion words, might not be meaningful for all people. And number 3 is something that we hear quite a bit from people. They ask, like, is alexithymia changeable? Like, is it something that you can improve? Can you improve your ability to identify and describe the way that you feel? And if that's a meaningful goal to you, the answer is yes. There is so much support, and we are learning from so many people in research and through lived experience that through an interoception based approach, alexithymia can be enhanced, that experience can be improved, that people can become more clear on how they're feeling. They can become more clear on how to describe the way that they feel. And it really circles back to point 1 and point 2, and embracing inner differences in the way emotions feel in our body, inner differences in the way that we come to describe the way our body feels. If we can embrace those differences, many times that alexithymia experience can be enhanced, coupled with a lot of interoception work and connection to the body when we feel safe enough to notice how our body is feeling. Until next time.